My name is Lieutenant Colonel Stali. I'm retired. I used to work for the Defense Force Medical Services. Upon retirement, I took upon myself to form an organization or an imaging center that will help to alleviate the problems that our communities have in as far as assessing quality imaging services as closer to their homes as possible. So mainly my interest is the imaging or the scanning of the heart, because we know that the heart has a lot of problems that affect it, either acquired or those that someone or a patient has been born with. So the heart, an echo is actually just an ultrasound of the heart. We visualize the heart the way we visualize other organs in the body. But the good thing with an echo is that we're able to see the heart from outside into the inside. We know that the heart is made up of heart muscle, it's made up of valves, it's made up of heart chambers, and also the big blood vessels that enter the heart and those that go out of the heart. So in this program, I'll try by all means to show or to demonstrate a normal functioning heart and also certain diseases that are common in our community that affect the heart. We know that it has been very difficult for the people in our community to access these specialized services. Sometimes our clients are made to travel out of the country just to acquire a very good ultrasound assessment of their heart. We have hospitals around, they are also able to do some of these tests, but they are overwhelmed because of the number of cases that are affected. So we have put up a program also in a way just to help the government on the efforts that they are making in reducing the deaths that are due to heart problems by early diagnosis of cases and treatment. We actually don't do the treatment component. We just identify the cases and refer to specialized clinicians or doctors with the detailed reports of any heart problem that come to us for assessment. So I'm going to demonstrate how to do an echo on a patient who has no heart problem. Because that is the main thing. For us to know what is wrong with someone's heart, we should know how a normal heart looks on an echo. So the first thing that you do when you are doing an echo, is to position the patient. The positioning of the patient is very important. We know that the heart lies on the left side of the patient, so which means that for us to have a good view of the heart on an echo machine, the patient should lie on the left side. Thereby, because the heart, when it falls on the left, it will expel the air from the left lung. Because we know that air is an enemy of ultrasound waves. Wherever there is air, the sound waves are obstructed, so you don't get a good image from the patient. The second thing that you do, you select the right probe. A probe is just a piece from the ultrasound machine that helps us to get a better image of any organ that we are going to evaluate. We add the gel on the probe. The gel helps us to move the probe on the skin without any roughness. It also helps to expel the air between this probe and the skin. Because as I said earlier on, air is an enemy of ultrasound waves. So I'm now going to demonstrate how to do an echo on a person who has got no heart problem. I'll start, there are so many windows that we use to look at the heart. I'll try by all means to go through all the 4 windows explaining as I move to one window to another. So in this case, we assume that we have entered all the information of our patient. We've entered the name, the first name, the last name, the date of birth, the age, the gender, and also we've chosen what we are going to do. In this case, we are going to do a cardiac scan. A cardiac scan, we press on the machine menu where it is written CAD. And from there, we have to go and activate our screen. We just go to, of course, you should also indicate there, you yourself, the echocardiologist who is doing the echo, your name should appear there. And the doctor who is referring the patient to you, the name should also be entered. Once you are done, then you go to your active screen. From your active screen, you go again to the menu of the screen, then you choose the probe that you are going to use. In this case, we are going to use a cardiac probe. The cardiac probe is a probe that only specifically made to image the heart. So immediately I put my probe on the chest. Already I'm seeing that there's a heart actually contracting and relaxing. This view, the first view that we use to scan the heart is the long axis view. It's like you're cutting the heart longitudinally. So from this view, the structures that we see the left ventricle here. We also see the right ventricle. We also see the mitral valve. We also see the aortic valve. The other structures of the heart are not seen in this view. They are seen in other views that I'm going to demonstrate. We don't also see the apex of the heart in this view. The apex of the heart will be seen in other views that I'm going to demonstrate. So as we are looking at this heart in this long axis view, there are a lot of things that we actually can note. We are noting that this heart is contracting and relaxing normally, because we are seeing that there is a squeeze and a relaxation. So the blood is actually moving from this chamber, the left atrium, is being pumped into the left ventricle. Then the left ventricle, the main pumping chamber, is pumping blood into the aorta, and the aorta releases the blood to the rest of the body. The top chamber here is the right ventricle. This chamber receives blood from the rest of the body and pumps it to the lungs. So in this view, these are the structures that we see. We also see the size of the heart muscle. This is the heart muscle here. This is the septum. That is, the septum simply is just a wall that divides the two major chambers, the left ventricle and the right ventricle. So in between these chambers there are walls. So we also look at the thickness. In patients with hypertension, we find that they tend to develop a thick muscle as the heart is protecting itself from being damaged. So develop the muscle as a compensatory mechanism. So I'm going to change now. In this way, we see that this point here is facing the patient's shoulder. So to come to the short axis, because I was in the long axis, I'll just simply rotate the probe clockwise, then I get my nice short axis. The short axis should look as a circular, and on top there's a right ventricle which is crescent shaped. If I go again, I'll go at the level of the mitral valve. I'm seeing something flapping there. That's the mitral valve. From this view, the short axis view, you can also look at the wall motion, how the ventricle is contracting inward and outward. A poor functioning ventricle will have poor contractility inward and outward. Again, within this chamber, we are able to see other structures that can form if the heart is not functioning properly. We can also, so maybe there are clots there, can also be visualized in here. There are other tumors that also grow in the heart, can also be seen from this view. From the short axis view, I'm now going to go to the 4-chamber view, in which we are going to visualize all the chambers of the heart. So this view I've just got here is the 4-chamber view. I can clearly see that there are 4 chambers here. There's 1 here, 2, 3, and 4, and in between the chambers there's a wall, what we call the septum. So this is the left ventricle, and this is the right ventricle, the left atrium, the right atrium. The structures that we see in this view is a mitral valve. There's also a tricuspid valve here, flapping, because the shadow here is not clearly visualized. If this valve is damaged, I'll see a lot of backflow, or what we call regurgitation. But in this case, when I put my color, it doesn't show any backflow, so which means the valve is closing, is opening and closing properly. When I take out my color, I'll need to optimize the image. Yes, that's an optimal image. We're interested mainly in the left ventricle and left atrium. So in this heart, we see that the structures of the heart, outside the heart and inside, are normal. There can also be fluid around the heart. So if there's fluid around the heart, we'll actually see that there's a swinging heart. The heart will be swinging. So in this case, we don't see such scenario taking place in here. So for now, those are the main chambers of the heart, and those are the steps that we take in evaluating the heart. Just to run it quickly, we start with the parasternal long axis. From the long axis, we simply just rotate the probe clockwise, then we get the short axis, which will show us the ventricle as a ring or the circle, and the right ventricle as crescent shaped. The ventricle is, the left ventricle is at the bottom, right ventricle is at the top. From this parasternal short axis, we go to the 4-chamber view. The 4-chamber view is very useful also to look at the size and the function of the heart. So in this case, this is our 4-chamber view. We see the mitral valve, tricuspid, and the 4 chambers of the heart. It is also worth to note that how clear the image is depends on the size of the client you are imaging. If your client has got a thick chest, the image will not be very clear. You struggle to get your windows, but persistence is important until you get what you need. For patients who are slim, it's very easy to see the images clearly because there is no obstruction between the probe and their tissue. They've got a thin tissue, but the fat patients have got a thicker tissue, so most of the sound waves are lost before they reach the target organ. So the other part of an echo exam is to know how to hold the probe. The probe should be held like a pencil, and when we are scanning, we are not supposed to be so much rigid on we're supposed to be flexible on the probe. Then we make sure the marker, this marker here, is facing to the right shoulder of the client or the patient. The other thing, as I mentioned earlier on, is the gel which is here. It's important to put gel on the probe because it will expel the air between the probe and the patient's skin. We all know that air is an enemy of ultrasound wave, so when you have a lot of air, you don't see much. So as you are starting your echo exam, the first window or the first view of the heart that you take is the parasternal long axis. We know that the heart is actually lying like this. The heart is lying like this. It's not lying straight like this. So when we take a parasternal long axis view, we are like cutting the heart longitudinally. So we are seeing the chambers in this way. So we are seeing the chambers in this long axis view. So the probe should be held in this way. That means you've optimized your image. You are in the right place where you've cut the heart with the sound beam in the longitudinal way. So the probe should actually be just slightly in the middle of the chest. So as you are now shifting, going to the short axis view, another view, if you are looking now at the function of the heart in the secular way, you just simply rotate the probe. And as you are rotating the probe, you are seeing the heart on the screen. Secular, there it is. When I go back to the longitudinal view, there it is. I'm going back to the longitudinal view, or the long axis view. Then likewise, I just rotate clockwise, then I get a secular view. I just rotate from here. Then from this short axis view, we are from long, then we move to the short. From the short, we go to the 4-chamber view. The 4-chamber view, if you are going to look at the apex of the heart, we are now looking at the apex of the heart. You really have to go down. So you really just have to move from lateral, you move medially until you see your image of the heart. There is a 4-chamber view. I'm imaging from the apex, so the probe is here. So I'm imaging from here into the left ventricle and the left atria, and I'm also seeing the other 2 chambers on the right side of the heart. So in this case, if you're looking for the function of the heart and the size, you go to the 4-chamber